Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center's Coffee Conversations. We are so excited today to have Emily with us. Again, we love having her and talking with her. She's going to be talking about a really good topic today that we felt was kind of important to discuss, not only just because it's the holidays, but just in general. Just how can therapy benefit someone going through life crisis, and just kind of talking about what is crisis and how do you identify that, and all of those different things today. So, Emily, for those who have not seen your coffee conversations with us before, could you introduce yourself?
Yeah, absolutely. Hey, everybody, I'm Emily. I am a social worker and I work now as a therapist at Oasis Counseling for Women and Children. Some of you may be familiar with Oasis and the partnership that we have with Forge. Also, we're neighbors with Forge. I was born and raised here in Alabama, in Birmingham, and went to college, Mississippi, came right back. Um, Prior to coming to Oasis to be a counselor, I worked in the healthcare setting. I worked in several hospitals around town and in other places, and have a little bit of experience also in the housing world. So some definitely that would be a lot of where my experience with crisis comes from, is in that kind of environment. And I have been at Oasis now for almost 5 years. I started in May of 2020. I am the COVID hire, is what everybody calls me. So
Most of us are COVID hires, though.
so that is just a brief little bit about me, and who I am. But if anyone has questions at the end, you can ask me more about me if you feel like you need to.
Well, that's one thing I love about social workers. We were talking a little bit before the call that just it's so diverse, the spaces that we get to be in and experience and kind of learn, how to work with individuals in vulnerable spaces. And so since today, I feel my voice getting a little bit deeper. But since today we're talking about crisis, could you please just kind of break down what does that mean? What does that look like? Is there a stereotypical version of what somebody might identify as a crisis? Kind of help us understand that word a little bit better.
Absolutely. So, one thing to note is what you consider a crisis may not be what I consider a crisis, and vice versa. Things that are crises are going to affect different people differently, and we're going to have different views of those. Your 2 year old who has pepperoni on their pizza and they didn't want pepperoni on their pizza, that is truly a crisis. That is like the worst thing that's ever happened to them, because their little brains aren't looking back or looking ahead. They don't have that capacity yet. And so that really is crisis for them. As a grown person, that's probably not a crisis for me. I'm gonna be all right. I'll figure it out. Um, but crisis is an event, or it can be a series of events that creates real or even just a felt sense of insecurity or instability. One thing that stands out to me about crisis is a lot of times this is coming out of the blue. Okay. I didn't know this was going to happen. And here it is. I had no warning. Um, and also, a lot of times when we think about crisis, when I think about crisis, we have to make really tough decisions in the midst of a crisis. That's one thing that sticks out to me as well. Crisis can affect individuals, it can affect groups of people or societies. So, natural disasters, changes in health status and diagnosis, violence, death, divorce, homelessness, other changes like that. When I was kind of digging around looking to see what other people thought crisis were, a lot of the things said crisis can be marked as a turning point. And I really like that idea, right? Usually, once we have a crisis, it does turn us and change us, and we're not going to necessarily go back to the same afterwards. And then, of course, a period of high or elevated distress.
One thing that you mentioned, thank you for that description, by the way. But one thing that you mentioned that I really loved is how you were saying, or you provided the example about the child and the pepperoni pizza. Um, and what I got from that is that it's subjective, right? Like, one example I love to use is that somebody's mountain might look like a hill to you, but
Right.
that's their mountain. We can't choose what someone else's mountain looks like in comparison to our own. So I think there's strength in realizing that crisis is subjective to individuals. Um, so thank you for that description and just breaking it down kind of easily. So if somebody who's never necessarily experienced crisis, and I say that with quotations, because some people might not recognize
Right.
that what they're going through is actually a crisis. How does someone have this epiphany or this realization that, oh, I'm having this breakdown because it's actually a crisis? It's not just an issue. It's not just an obstacle. This is something a little bit bigger than that. How do they differentiate those things as they're going through it?
Yeah. I think some crisis, there's like a big stamp, like this is a crisis, right? A car wreck, a natural disaster, something like that. The things that we don't necessarily can call out as crises or smaller things or a buildup of this happened, this happened, this happened, this happened. And in the beginning, it wasn't a crisis, but now that all these other things have happened, it is. Or maybe you're someone who has like always had poor health. And so you're like, oh, this is just another thing. Well, maybe it's just another thing. Maybe this crisis. I think one thing about crisis is a lot of times crisis affects our identity or our roles are changing in the environment. If something happens to me and now I'm the mom, you were saying you have 5 kids, right? I'm the mom and I have the flu and I have 5 children, right? And I'm used to taking care of all 5 of the children. Now I've got to take care of myself. And that's a little bit of a role change, right? Um, so that's a smaller example. But when we're talking about crisis, is there a change in your well-being? Is there a change in your ability to cope? Are you feeling detached from the experience? Or have you gone into fix it mode, into survival mode, where all you're doing is hyper focusing on this one thing? Physical symptoms, I always call this a chicken and egg question, right? Does my head hurt because I haven't had caffeine? Does my head hurt because I didn't sleep well? Does my head hurt because I flew? Does my head hurt because I'm anxious or stressed or depressed? GI issues, irritability, distractibility, feeling numb, or on the other end of the spectrum, overly emotional, and having trouble making decisions. All of these types of things, we may not necessarily put them all together, but they can be symptoms, if you will, of a crisis.
So I guess it's kind of easy to kind of overlook those things.
Oh, absolutely.
When you're in that survival mode, like you could have a comorbidity of all of that. You could have a little bit of the hyper focusing. You could have a little bit of the depression or the anxiety or the isolation. But it's easy to overlook those side effects, especially if somebody has been impacted by breast cancer, because so much of what you're going through has so many moving components. Can you kind of break down how it might be a little bit easier for them to kind of overlook that once someone is diagnosed with something as complex as breast cancer?
Yeah, I think so. So you're absolutely right. I think this is where we get into a chicken and egg question, right? I have been diagnosed with breast cancer. I mean, I haven't, but so you get a breast cancer diagnosis and you start treatment. And yeah, Anxiety and depression is going to be normal. Isolation is going to be normal. It's going to be normal not to feel good. All of those things are appropriate and expected. And so it's really hard to kind of parse out, like, is this normal? Is this not normal? Um, and it's going to look, again, it's going to look different for everyone, right? You and I could potentially have the very same diagnosis, the very same treatment team, the very same treatment plan, and we're still going to experience the whole thing very differently. I think it's important to know yourself and to be able to identify changes in yourself that are more concerning. For example, I didn't realize this till I was in graduate school, but I have like very somatic anxiety in my stomach. And I know that for myself. And used to, before I realized this, oh my God, what's wrong again? Da, da, da. Now, if that happens, I'm like, probably anxious because I have this thing coming up or this thing going on. So knowing yourself. And I think it's important also to implement things to take care of yourself and to continue your routines, to do as much, have as much normal as possible so that we can kind of differentiate what are we dealing with that is unusual or not appropriate for the situation. That I'm not sure that that makes sense. But
No, it totally does. And I think that it opens the door too, because sometimes we'll know ourselves before the crisis.
right.
Um, and we don't understand the changes, nor do we see it because we're living it. We're living through the crisis. We can't necessarily identify, I've changed in this way, but it might be a great opportunity, or would you agree that it might be a great opportunity to kind of lean into your support system too, and kind of like trust what their eyes and ears are hearing? Hey, I've noticed that you've been a little bit more anxious, and kind of having those types of conversations, I would think would be more helpful if you're going through the thick of it and you're just trying to survive and you don't even notice the harmful changes and impacts that the crisis is even having on you.
Absolutely. I think, who are your people, right? Who's your partner, your sister, your best friend, whoever it is. We don't want them to tell us, hey, you've been a little irritable lately, what's going on? And also that's really good information for us to have, because they're a little bit on the outside looking in, right? They're a little bit more removed from the situation than you are, and they can point out the changes that maybe you don't notice yet. We are, anytime there's change in us, a lot of times when I'm talking about this, if someone is losing weight, right, they're going to be the last to notice that they look different. First, it's going to be people you don't see all there. They're like, oh my gosh, and then it's going to be the people that you see more often, and then the people you live with. And then finally, one day, you're going to be like, hey, I lost some weight. I'm looking good, right? So I think that leaning on those people is really important because your role is changing and they can help you figure out what it looks like now.
So for those, and thank you for validating that, because you're like the therapist and stuff. So I don't want to give like, a therapist tidbit, and I'm not a therapist. But another question too. So if someone doesn't have that support system, or maybe they don't really trust them because they're too close to them, sometimes our support people can be very close to us, and they can try to feel the things that we feel and see it the way that we see it. So their perspective might be a little bit too attached to the situation to be a little bit more truthful about the impact, or to be more truthful about, hey, these are some changes that I'm seeing and it's unhealthy. And that in turn not really help the situation, trying to, I don't want to say enable, but they're just trying to comfort the person the best way they know how. So I feel like this is an opportunity when therapy can come into play. So how can someone start that process. They're not necessarily comfortable with it. They don't know what that means, but they know that they need someone who is removed because not everybody's a support group kind of person.
Right.
Everybody's not I'm going to show up and talk to a bunch of people. And even though it can look so different, support groups are very diverse. But that's not everybody's cup of tea, but they want someone who's not in the mix with them. Um, what are some first steps that you would recommend to somebody who wants to explore that option? And also, what ways can therapy help with crisis management, especially for those diagnosed with breast cancer? Can you hear how tired I'm getting?
Yes, I can. Yeah.
But especially just for those who are diagnosed with breast cancer.
Yeah. So one is, you guys, if you're listening to this or you're participating in this, you are aware of Forge. And Forge is an excellent resource that we have in our community. We're so lucky to have you guys. And so with Forge, you can have individual therapy here at Oasis. Several of the therapists here work with clients from Forge. And so that is a great way to start, right? You can inquire about that with Forge, and then they'll get you over to us and we can get started. But other options, if you didn't want to go that route, right? Talking to your primary care or to your oncologist, letting them know, hey, I want to check into some therapy. Do you have some resources? And depending on your treatment team, where you're receiving treatment, they may have that available there for you as well. Starting therapy is scary, and the hardest part is making the appointment and showing up to that very first one. Then after that, we go from there. But that's like the big step, and then you're done. You're not done, but after that, usually after that first appointment, people come in there way up here, and we have that first appointment, and it's like, okay, there's some relief. I have someone now. I've done this big scary thing for the first time. So one thing about therapy is when you meet with me or another therapist, we're going to talk to you about things that are going on, and we might be able to talk about some of those things, right? Because maybe you're like, I wake up every morning at 2 a.m. and I can't go back to sleep. And that's just like how you live your life. And you might think that's normal. Well, that's not normal. So we can help you identify some of those things. We're going to look at some things that are symptoms of mental health that maybe people don't immediately go to or realize: memory, concentration, sleep, appetite, energy levels, thought patterns, that sort of thing. We can help you identify some of those. The reason that I think therapy is so helpful in a crisis is because I don't know you. I'm not your people. I'm not in your circle. I can be a place that is just for you, right? It's not for your husband. It's not for your kids. It's not for your mom. This is a place for you. And when you're with me in the therapy room, I am a safe and neutral environment, right? I'm not going to judge you. You can say things to me that you don't want to say to your support people because you don't want to worry them, or a lot of people have concerns of burdening their family members. But therapy, that's what therapy is for, is for us to provide that space for you, and to help process and be, but I'm like, yeah, you can be angry, you can be scared, you can be sad, we can laugh, we can cry, we can be whatever you need. One thing that I think is important is going ahead and getting plugged in as early as you can, because you do, so you have a diagnosis, you start treatment, and we're in that fixed mode, go, 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 go. And one day all that's over and you're like, oh, what just happened? I have just spent like months or a year or 2 years or whatever fixing this thing, and then it all comes crashing down. And it's like someone has released it on the pressure cooker. Like maybe all those feelings have been locked in while you're trying to survive, and then it comes. And so if we get plugged in sooner to a diagnosis, maybe we can process some things as they come and not let them build up.
Right, because that can lead to another crisis.
Right.
And just because you didn't necessarily recognize it when it was beginning, which can be hard sometimes when you're in that survival mode. So there's no fault in not recognizing
Oh,
crisis,
absolutely. Yeah.
but there's such power and freedom in being able to recognize I'm feeling a change in myself and I need to find a safe way to explore how I can feel better.
Mm-hmm.
So what techniques could someone use to kind of, I mean, because I feel like everybody's in a state of lulu right now because it's the holidays and it's the end of the year. So I mean, even if you're not, a person who celebrates holidays, just the end of the year in general is always hectic because work is wrapping up numbers and all of the things and kids in school and all of this, that, and the other. But what are some things that you think that someone could use to kind of help manage their anxiety and their fears in this season of life? But then also, you take someone who's just dealing with that, but someone who's also still going through breast cancer treatment, somebody who's newly diagnosed on top of that end of year hectic life and state I feel like our country is in these days. What are some things that you could kind of advise those individuals right now that you think would be helpful?
Yeah, the holidays are a super busy time. I know I mentioned a minute ago Santa Claus, and that for me makes things a little bit extra busy this time of year. But same thing here at Oasis, we're trying to wrap up, we're getting stuff settled, and we have family events and friends events, and this kid has this thing, and this kid has this thing, right? And we're torn all over the place. And if you are also going through cancer treatment or diagnosis or trying to figure it out, especially if you are newly diagnosed right now, that's going to be really hard because the providers are in and out. They're on vacation here and on vacation here and not here. And it's going to be a delay in, reading results and that
And
sort
then the family has all the questions, and you don't want the holidays to be about the new diagnosis or the diagnosis you're still dealing with.
Right. It's like a worse version of coming home for the holidays in college where they're like, dating. Now, oh, tell us about your cancer. Tell us about your treatment. And probably that's the last thing you want to talk about while you're trying to enjoy the holidays with your family. Um, so I think one thing, if we're talking specifically about the holidays, it's okay to say no, right? You don't have to go to every party. You don't have to go to every gathering. You don't have to cook all the food, right? Who can you ask to help? How can you say no? How can you protect yourself? Um, I joke with some of my young adult clients, and we joke about it, but also this is true. Drive your own car. You can leave when you want to leave. Have headphones, will travel. Okay. Pop those headphones in, go outside, take a break. Um, those things are true resources that we have. Um, so one of the other things, both during the holidays, for anyone during the holidays, and then for anyone who's going through treatment or diagnosis, again, we want to maintain as much normalcy as possible or as much routine as possible. So one thing that I like to do with all of my clients, but particularly in a situation like this, is do something every day to connect to yourself, to connect to nature, and to connect to someone else. So these don't have to be like big, grand gestures or expensive things or hard things, right? If you're going through chemo, you're not feeling great and it's going to feel daunting to do something big, but I can go outside and put my bare feet in the grass or spend 5 minutes in the sunshine. It can be small things like that. Text a friend, write a note, send a TikTok to somebody that something like that. Hey, I'm thinking about you. And then to connect to yourself, do something that you like to do. And again, it only has to be 5 minutes. Like if you like to do a jigsaw puzzle, do a jigsaw puzzle for 5 minutes. I have the New York Times games app on my phone. It's got like a crossword and Wordle and all that stuff. I've been doing that every day and I have really enjoyed it. I think it might be making me smarter too, so I'll take that. But finding something like that is just for you, right? It's not for partners, it's not for kids, it's not for parents. That is for you and that you enjoy doing. One reason this helps too is if we get in the habit of doing this when we're not in a crisis and we can continue it through a crisis, it helps us to feel grounded. It helps us to have kind of some touchstones. The other thing is doing something creative every day, right? Again, this doesn't have to be big or grand. Embroidery, watercolors, whatever, gardening. I suggest also to people related to creativity, trying a new recipe. You got to eat or feed your people or both. And I'm telling you, you need to be creative. So maybe you can cook a new recipe. And I don't tell people you have to do that every day because that's a lot. So maybe like once a week, you can have like pizza night and make pizza or, do something fun. Then some of these things I know you hear all the time from all the people and you're like, oh my gosh, I'm gonna say it again. Please drink lots of water, stay hydrated, moving in any way that you can, stretching, yoga, walking, anything that you can that's comfortable for you. And again, it doesn't have to be big, right? This can be like walking laps in the hall in your house, okay? Or, sitting in your chair and doing stretches, eating and drinking well. The other thing, I know I'm long-winded, so I'm going to say this and then you can pop back in, but
No, you're fine.
One thing I find helpful for people going through treatment, for when you're actually in treatment, like when you are actually receiving radiation or you're in the chemo chair or you're having a scan, have a mantra that you can repeat to yourself. So this can be scripture, it can be song lyrics, it can be hymns, poems, whatever that is soothing or comforting to you. And you can just repeat that to yourself. Quote from a book or a movie. It's a positive distraction. It's something that is known, right? If I'm using a quote from my favorite song or hymn that is known to me, that's comforting to me. And so that can be a great way just to ground yourself. So I've got some other things too, but what's next, or what are your thoughts that you're having?
I love that you provided so many different alternatives to creativity because oftentimes when we think of creativity, like I didn't even think about a recipe, partly because I hate cooking. But I think that it's nice, like to think about, oh, well, how can I create something that could be beneficial to me, but also I can feel like I'm being a little bit more productive. Like I love how innovative that came across. So thank you for all of those tips. And this has been so wonderful. Do you have some final thoughts you'd like to leave our listeners and viewers with?
I think, recognizing that you do have resources available to you, right? Asking, like, don't be afraid to ask questions. Ask your treatment team, call Forge, call Oasis. And know that it's okay. Breast cancer sucks. The holidays suck sometimes. And those are okay. Those are normal things and those are normal experiences. And you don't have to be going through a crisis, right, to get help or to need help. And so, just practicing taking care of yourself. I know that's a big thing, especially in the breast cancer community, because a lot of breast cancer, the majority of breast cancer patients are women, and they're, caretakers in their day-to-day life, whether it be to their children or their parents or a partner. But you have to take care of yourself. And you can only take care of the people around you if you're also taking care of yourself. And that's really important.
Well, thank you so much, Emily. We love having you on Coffee Conversations, and this has been wonderful.
Yeah, I love to be here. I'm anytime happy to.